Reactive attachment disorder is a condition that is not very well understood in mainstream medicine. There are different qualities to it that distinguish it from typical oppositional defiance, ADD, or anxiety. Today on Ask Dr. Gill, I want to talk more about this condition, how to distinguish it from those other ailments that we see, and why it's important in this particular case to do so. So stay tuned. Hello and welcome back to Ask Dr. Gill. I'm Dr. Gill Winkleman, your host, and I have pretty much taken the summer off. I've had many travel plans and was hoping to have podcasts ready to go, but it didn't happen, so I apologize. And I am back in the radio seat, as it were. So today I want to talk about reactive attachment disorder, or RAD disorder. It's a big part of my practice, but more importantly, it's an aspect that I think is not very well understood, and it's frequently misdiagnosed. And I've written an article about this, and I decided to do a podcast as well because I know many people either don't read the website and prefer to listen to this, but also I think I can cover some different aspects of it as well. So that's the goal here today. And, the thing about RAD disorder that's interesting is that there are, if you Google RAD disorder, you'll actually get about 3 or 4 different definitions of what it is. The first is a mainstream medical condition, which considers it to be very rare still, and affecting only about 1% of the population in the United States. I actually respectfully disagree with the mainstream medical community about that and their definition, though I think that they do recognize an aspect that it is rarer in biologically based parents than adoptees, and I'll get to that in a minute. So in their definition, it's more about a failure to thrive in the child, and so then there's no bond, in effect, with mother-child or, caregiver and child. The psychological definition is strictly just about that. And, it's kind of a... If you've done any psychology, there's a whole theory of attachment parenting and attachment theory around that. And in effect, that's kind of another definition, and it's just about, can the person form that primary bond? Now, there's a broader definition that I think is important to explore, which is that it's not just about the inability to bond with mom or dad or whoever the primary caregiver is, but it's an inability to bond with pretty much anyone. The one exception is that we do see trauma bonding amongst siblings who are in abusive situations, but other than that, they have no ability to bond or attach to another human being very well. And, this can lead to a mild dysfunction in life where it could look like you don't have any really close friends. You may not be able to handle a job, or a job that may be below your intelligence and ability level. Or it could be, grow into something a lot worse, such as, violent behavior and sociopathic behavior. And typically, I don't see that, because by that time they're beyond help, or they don't seek help. Although I have seen a little bit of that in the past, but in an ideal world, the treatment happens way before then. So So that's kind of the nutshell of RAD. And if you go through sort of the DSM definition, a lot of the traits of reactive attachment disorder will look a lot like many other conditions, such as conduct disorder, intermittent explosive disorder, obsessive compulsive disorder, anxiety, and potentially autism and Asperger's. And in my article, I kind of talk about some of these. You've got social interactions that are inappropriate with peers or adults. And one thing to note here is that you'll see younger kids bonding with a particular adult who may not be a good choice for them, for whatever reason, to bond with. Not, in other words, not a teacher, not a parent, not a caregiver. Oftentimes you see social avoidance. They won't play with anybody. They might not want to be comforted or touched. They might attach to objects but not people. Sometimes there is violence, like I said, destroying of other people's property and belongings. There might be lying, cheating, or stealing. There might be outbursts and tantrums, and breaking rules. And typically they tend to be very defiant. Now, I'm telling you this list, and just hearing this, you're kind of like, well, that could be. Does that mean my autistic child has reactive attachment disorder? No, it doesn't. Typically, what I see, kind of the litmus test that some of the psychologists have mentioned to me about this is, do they apologize? And if a child can feel some remorse about a situation, and not when they're being, when there's a consequence about to happen, but actually before that point, or on their own, they'll say, hey, I'm sorry about this. And that, people mess up. They'll do stuff, particularly kids. And, my kids do something, and they'll come to me later after they've calmed down, and they'll say, hey, I'm really sorry. I didn't, I was really upset. I didn't mean to yell, and whatever it is. That's an appropriate response. And in all of the other conditions I mentioned before, you're going to hear that. You're going to have them be able to come to you. Or if you sit down with them, they may not be emotionally mature enough to do that, but at some point there's some level of remorse. With RAD, that does not happen. And that's kind of like a thumb in the wind test. Now, if you suspect, I'm going to just say this up front, if you suspect that your child may have RAD, I highly, highly, highly recommend getting an assessment done by a qualified healthcare professional. And I say that because I think that oftentimes parents go into denial about this situation, and particularly if your kid has not hit puberty, it's, I think, really, really important to get this treated early on, particularly before puberty, because once the hormones sort of come through and, start sort of being part of this, it can become really messy in terms of treatment. And I think that it's definitely a lot easier. There's a higher success rate. And I'll explain sort of the biochemistry of that in a little bit. But I highly, highly, highly recommend getting that looked at, having it looked at before that. And if they've already hit puberty, the sooner you can get them in, the better, for all kinds of reasons. So how common is RAD? And this is sort of one of those things that is tricky to answer. And it's tricky to answer in part because we don't really have a good definition. And I think that unlike a personality disorder, which you can't technically have until you're 18, it's not very obvious. And I think that much like a personality disorder, people have RAD traits that look like RAD, but it's not necessarily full-blown RAD. So, and if thinking in terms of adults for a moment, because RAD does exist in adulthood, and there's a number of books that discuss relationship issues, and there's this concept of a distancer and a pursuer in relationships. Well, the distancer is the person who pushes away and doesn't like being close, and the pursuer is someone who wants to be close and tries to do that. And without getting into too much detail around that, that is an aspect of relationships, and it's been written about, and you can look up various books on this. And on the surface, the distancer can look like a RAD disorder. However, I would say that not everybody who's a distancer has RAD disorder. Like, there is an aspect of RAD-ish-like behavior there, but it isn't a full-blown disorder. And much like that, people can have, for example, narcissistic tendencies, but not necessarily being a full-blown narcissistic personality disorder. So I just wanted to kind of caution things there and, kind of mention that. So RAD, is definitely more common in adopted kids. And some of the studies say it's as high as 45%. And, we see it, we definitely can see it in adult families, and I think that is increasing and has been increasing over the years. But overall, I would say, my experience is it's definitely, I see way more kids who've been adopted. And part of this, just so you know, is kind of self-selective. So some of the kids that I have are with bio aunt, uncle, grandma, etc. And bio mom, usually it's mom, but sometimes it's mom and dad or just dad. Usually there's a drug use component here. And so as a result of that, I think we see, the RAD issues come up because mom and or dad wasn't around for appropriate attachment, and caregiving. So in the next part of the episode, I want to talk about how we treat RAD and sort of what I do about it from a naturopathic perspective. So stay tuned. I'll be right back. Okay, welcome back. This is Ask Dr. Gill. I'm Dr. Gill Winkleman. So let's talk a little bit about how we treat RAD. And here's the quick thing about RAD that I need to say. I think counseling is required with an appropriate therapist who understands RAD. I have treated anxiety, ADD, OCD, depression, various mental health conditions without having a therapist involved in the plan. And we've looked at the biochemistry, we've done, Walsh protocol, we've done pyroluria testing, we've done methylation testing, we've looked at adrenals, the whole shebang, and had successful treatment. With, usually it's one of those things, and I can usually figure it out with the intake, or it's brain injury and we treat, using neurofeedback. And people get better. With RAD, it always requires therapeutic intervention, psychotherapeutic intervention, 100% of the time. And unfortunately, it is a long, arduous haul for most parents. It not only requires lots of therapeutic interventions, but it requires a very structured parenting plan. And it's kind of like having a German Shepherd. If you've ever had a dog, you know how certain breeds can get unruly, and German Shepherds are one of them. And, you definitely love them, but you can't let them get away with anything. And if you don't, and you do that, they are the most amazing dogs. And if you don't do that and you're not consistent, they will be difficult. And that's kind of what we deal with reactive attachment disorder. And I think that the parenting aspect is really, really important, and that is not a role that I play as a naturopath. So what I do, and what I think that is still important regardless, because it makes the parenting issues that much easier. And by the way, that's true regardless if the kid has RAD or something else. It just makes parenting easier. But I look at sort of the first thing we look at with RAD is pyroluria. I think I have a podcast about it that I did earlier in the year, and in the series, and you can find it on the website www.askdrgill.com, askdrgil.com. If you happen to be listening to this through iTunes Store or some other method, but the pyroluria is kind of it's basically a urine test. It represents an incomplete breakdown of red blood cells, and zinc and vitamin B6 are getting used up in the body, and this will throw the adrenal glands out of balance. But more importantly, usually there's also a copper imbalance with that. And so what happens with copper imbalance is that you get a spike in adrenaline that happens. And so this can explain sort of the pushing away that happens with the RAD kids. So most of the kids that I've seen with RAD have pyroluria, probably about 65%. And, it's an easy enough fix if you know that. Now, most of those kids also have another imbalance as well, whether it's also they have high copper concurrently, or they have a methylation issue, or they have heavy metal toxicity, or their just adrenals are fried and need to be worked on. They have something else going on. Now, one of the curious things about RAD, and I write about this in this article on my website, is how there is almost, for the most case, no physical symptoms other than insomnia with most of these kids. Now, there is an exception to that. There's the kid who everything makes them sick, right? So that's a different attention-seeking strategy that I do see, but the majority of them, they have no physical ailments. And you kind of go through their history and realize how traumatic it has been. And it's like, wait, you should be having symptoms, is kind of what I thought initially. They don't have symptoms. So that's another clue, by the way, as far as a child potentially having reactive attachment disorder. So if and typically, by the way, this is an adopted child. You're not going to look at their case if it's yours and think, yeah, they had a lot of trauma, like if it was your bio kid. Although I do have patients who do come with that. And I actually had a patient many, many years ago who came, and it totally looked like RAD at the surface. I thought it was RAD. It was a biological mom. She had been, I wouldn't say addicted to painkillers, but she was taking them. So she was taking a fairly high amount of opiates. It was, controlled as far as physician, supervised type thing. She had a herniated disc, and it was just awful for her pregnancy when she was pregnant. And this kid came out, and he was probably 11 or 12 when I started seeing him. And I thought he was RAD. And I actually sent him to the specialist that I worked with at the time. And she says, no, he's not actually RAD. She's like, I could totally see it, but he has outbursts and he apologizes. And he actually has a good relationship with mom, even though you don't see that in your office. And it turned out he was overmethylated. So we treated that. He didn't have pyroluria, by the way. We treated the overmethylation, and lo and behold, he was, started doing much better in school, more energetic and that sort of thing. But he also really didn't have any symptoms. So it was kind of curious. And after we treated him, he started having symptoms. So just one of those things. I mean, there's no hard and fast rules. It's important to kind of pay attention to that and kind of look at it. So the last thing that I wanted to mention is neurofeedback. There's different types of neurofeedback. I think I mentioned, and I have a podcast about this too, and I may do another one about it because I've had some other questions come in that maybe I didn't answer very well in the last podcast. But neurofeedback, I use LENS, low energy neurofeedback system. Very, very good for treating RAD in certain circumstances. And there's really no one size fits all in terms of the neurofeedback. There's a new system called Neurofield that I haven't used, but I've heard people are getting amazing results in treatment of RAD. So that's another thing to look at. And if you have questions, feel free to send them over to me. It's info at askdrgill.com. That's all I have this week. If you have questions, send it to that email, or if you have a topic you want me to cover, send it to there as well. So look forward to seeing you guys next time, and I will talk to you then. Take care.